All right, hi, I'm Leola. This is going to be my medication administration video. So I'm just going to do a video of my surroundings. So this is my dad. He's going to be recording me. This is my little sister. She's just going to be hanging out with us. Got my backpack, but it's all zipped up. Shoes. I have, these are 2 of my drug cards. These are my lab levels that I looked at just recently. These are the rest of my drug cards. And then I got my provider's orders, and my MAR is in here as well. All right, so this is the med cart. The rest of the room. This is my other sister who will be doing Joseph Smith. Okay, here is the phone. All right, prior to getting started, I'm just gonna gather my drug cards. A little scattered here. Okay, so for nursing considerations for digoxin, it would be to assess a pickle pulse for 1 minute prior to giving medication, making sure pulse is not lower than 60, monitor electrolytes, monitor renal function, monitor HKG. For warfarin, it is going to be, some considerations would be monitor blood studies, monitor BP, assess for fever, rash, or hives, and assess for dosage change. For Tylenol 3 or acetaminophen and codeine, some considerations would be to assess pain and monitor patients closely for respiratory depression, and then monitor development of abuse. For furosemide or Lasix, some considerations would be to assess fluid volume status, monitor electrolytes, and then assess BP for hypertension, and then assess for toxicity. And then for oxycodone and acetaminophen or Percocet, some considerations would be to assess pain, central nervous system changes, allergic reaction, and then respiratory depression. Before going into the patient's room, I'm just going to verify lab levels. So it looks like the electrolytes are just a little higher than we want them to be, but that is going to be lowered a little bit with the furosemide, which I'll be giving as it's a diuretic. So I will be giving that. But in creatine are a little high. Those are for the kidney, so the kidney function is a little diminished. INR, that's for the warfarin. That is at a 3.7, which is higher than we want it to be. So just until we see that get lowered a little bit or I get further context from the provider, I am just going to hold that warfarin. Digoxin is also a little bit on the high side. It is at 2.1. Toxic level is at 2.4. So I am just going to be holding that until further notice and I get something from my provider of when I can give it again. All right, that leaves us with the acetaminophen and codeine, Tylenol 3, and oxycodone, but I will monitor, get pain level in order to know which one to give, and then I'd be giving furosemide, so I will separate these. All right, now I'm going to go into my client's room and just get pain level and getting vital signs. Hi, I'm Leola. I'm going to be your student nurse. I'm just going to provide privacy and do my hand hygiene. Could you give me your name and your date of birth?
Joseph Smith, 10/5/1954.
All right, and do you have any allergies?
Sulfa and betadine.
Can I just check your wristband just to verify that? Okay, and today we're just going to be giving you your medication, and I'm going to be also doing your vital signs. Do you have any pain right now?
A little bit, yes.
And where is that pain located?
My foot.
And on a scale of 1 to 10, or 0 to 10, what would that pain level be?
About a 4.
Okay, and then I would do your vital signs. For the purpose of this video, I'm not going to be doing vital signs, but in the real world, I would be doing vital signs and ensuring that all the vital signs were in normal ranges. Alrighty, now that we did your vital signs, I'm just going to perform hand hygiene again and head out. Are you comfortable?
Mm-hmm.
Alright, I will be back in a bit with your medication. So now I am going to be looking at the provider orders and the MAR. Okay, so the provider order looks like for furosemide or Lasix, it's 40 milligrams by mouth, and this is for Joseph Smith. Joseph Smith, furosemide, 40 milligrams by mouth, 2 times a day for congestive heart failure, 2 times a day for congestive heart failure. The status is active, and then it has not been given yet, so it is the correct time to do so. And then I am also going to be doing the Tylenol 3 for her pain rating of 4, and that's acetaminophen 300 milligrams and codeine 30 milligrams. So let me go to the PRN medications over here. Acetaminophen, 300 milligrams, and codeine 30 milligrams. So that is correct. Every 4 hours for pain, every 4 hours for pain of 1 through 4, 1 through 4 is active and it has not been given yet. So we are good to do that. Now that I've done that, I'm going to put my provider orders away and I'm going to start getting out my medication. All right, so first I am going to do that Tylenol 3. So Tylenol 3, 300 milligrams of Tylenol, and then the 330 milligrams of codeine. So let me just verify that. Yep, and then it's for Joseph Smith. Right time, it has not been given yet. By mouth, the right dosage, right route. And the expiration date is December 2035, so it has not been expired yet. And the integrity of the package looks good. So next, we are going to do that same thing for Lasix here. So we need 40 milligrams by mouth. It looks like these tablets are 20 milligrams a piece. So I will be doing 2 of them. So 40 milligrams, which I have the 220, so that makes 40. They both expire April 2041, so they're not expired. Both packages look good. And then it's for Joseph Smith, right route, right dose. And then right time, it has not been given yet. All right, I'm just gonna do that again. So I'm gonna do the Tylenol 3 first. So it's the right patient as it is Joseph Smith. Acetaminophen, 300 milligrams, and codeine 30 milligrams. That is correct, 300 over 30. It has an expiration date of 12/20/35, but it's not been expired yet. Integrity of the package looks good, and it has not been given yet, so that's good. Right dose, right time, right route. Now I'm just gonna do that once again for this Lasix. All right, so for the Lasix, the 40 milligrams, but instead of 40, I have 220 to make the 40. They both expire April of 2041, so they are not expired. Both packages look good. And it is the right route and right dose and the right time. It has not been given yet, and it's for Joseph Smith. Alrighty, so now I am going to take my MAR. I'm going to grab my 2 1-pagers, which is the Tylenol 3 and the furosemide, and I am going to enter the patient's room. Hi, I'm back. I'm Leola, your student nurse. I'm just going to provide privacy again and perform hand hygiene. Could you tell me your name and your date of birth?
Joseph Smith, 10/5/1954.
And what are your allergies?
Sulfa and betadine.
Can I just double check that? Perfect. All right, so I got your medication here for you. Are you able to swallow pills okay?
Mm-hmm.
Okay. So I'm just going to scan your wristband here. And I'm just going to double check with these medications. And I'm also going to put gloves on before touching them. So we are going to do the Lasix first. So the Lasix is 40 milligrams. I have 2 20 milligram tablets. They both expire April of 2041. So they're not expired. Integrity is good. It is for Joseph Smith. It is the right route, right dose, and the right time. It has not been given yet. And then I have my Tylenol 3. Let me go to that here. So that is by mouth every 4 hours. This is the right route and the right dose, which is the 300 milligrams acetaminophen and the 30 milligrams codeine. And then it's the right patient for Joseph Smith. Integrity of the package looks good. It expires December of 2035. So it's not expired and it's the right time, not been given yet. So I open it up and put it in the cup. All right. I have your medication ready. Do you need help sitting on the edge of the bed?
Mm-hmm.
Okay. All right, and then I would scan your wristband, and before I would open it, I would have scanned all 3 medications just to make sure they were correct. All right, so here is your medication, and here's some water. Can you take those for me, okay? Okay, and you'll open your mouth, just make sure you swallow them, okay? Perfect. All right, do you need help getting back in bed?
Mm-hmm.
Okay. Alrighty. And before I leave, I'm just going to educate you a little bit about your medications. So for that Tylenol 3, it is for your pain. So it blocks pain impulses. Could you repeat that back to me for what the Tylenol 3 does for your pain? It blocks your pain impulses.
Blocks my pain impulses.
Yep, so it's going to help with that pain that you're having in your foot. And then some side effects you might have are dizziness, headache, diarrhea, and abdominal cramps. Those are pretty common with Tylenol 3. And then for your furosemide, that is a diuretic, so it inhibits reabsorption of electrolytes. You want to repeat that back to me of what it's used for?
Inhibits reabsorption
Yep, of your electrolytes.
of my electrolytes.
Yep, and that is for your congestive heart failure. And then some side effects of furosemide are headache, hyperglycemia, rash, and cramps. Those are pretty common as well. Do you have any other questions regarding your medication? Alright. And are you in a comfortable position?
Mm-hmm.
Okay, and let me just make sure your bed is low and locked. Alright. And here is your collar. Is right here okay for me to put it on your shirt? Okay, perfect. So I have your collar light, your bed is low and locked, the side rail's up, you have your table with your water in it, or water on it, we'll pretend this is water. And then the floor looks good, it doesn't have any fall risks. Alright. Anything else I can do before I go? Okay, you just call that call light when you need me, okay? And then I take off my gloves and I perform hand hygiene again. And then I would leave. And I would make sure to go in for the patient and just reassess her in 30 minutes with vital signs and ensuring that she's not having any adverse reactions to the medication. And then I will document on here that which medications I gave, and I will document why I withheld the medications I did. Okay, thank you.